Hey everyone, Luke Gordon here, and today's video is about shoulder surgery and what you can do leading up to surgery to make your after surgery recovery a little bit quicker and less painful. So that's the topic. Again, we're not looking so much at what you're going to do after your surgery, although certainly we can talk about that another day. But today is if you're heading into shoulder surgery, whether it's a pretty minimal surgery or something more invasive like a rotator cuff, there's definitely some things you can do in the month or two prior to your surgery to increases the likelihood of a successful outcome and just to make the rehab process a little easier. So I'm going to go through those today. I believe I've got 4 of them. Got 4 tips for you. So the first one with the shoulder, if you look at the shoulder in general, it's very flexible. So a lot of motion in the shoulder in terms of reaching it forward, back, side to side, and then it rotates both directions as well. So when you're going to get into your post-surgical recovery, that's one of the things you're going to work on early is getting your shoulder to move again. So it should make pretty good sense that before surgery, if you can improve the flexibility, or we call it range of motion of your shoulder, it should be a little bit easier to regain full motion after surgery. So that's your first tip. Get the shoulder as flexible before surgery as you can. Now, depending on your comfort level, how painful the shoulder is, you might work with a physical therapist on that and get some stretches down. Or if you're pretty comfortable with it and you've gone through physical therapy before, just keep working on your stretches. So you got, common stretches like working on the pulleys, or whether you're working like with a stick or a dowel and just working the rotational motions. So try to have a good understanding of what motions are limited and what you can do to improve them without making your shoulder worse. Again, you don't want to really flare up the shoulder going into surgery, but as much motion as you can get prior to surgery makes it much easier to get after surgery. So that's your first tip. The second tip then is typically a lot of the shoulder surgeries are involving the rotator cuff muscles. And even if you're not having your muscles worked on like as a repair, you might be having like the bone shaved away. We call that subacromial debridement, stuff like that. Typically, people with shoulder pain and shoulder surgeries, they're going to have weakness in their rotator cuff muscles. So again, within reason, without making things worse, the more that you can do in terms of strengthening your rotator cuff muscles with comfortable exercises, that's going to behoove you, because then after surgery, it'll be that much easier to regain the strength. So that's your second tip. Work on rotator cuff strengthening as much as you can. And again, I would say keep your strengthening exercises comfortable, which we always recommend with our patients here in the clinic, and just try to build that strength as much as you can. So that was tip number 2. Already kind of alluded to it with those first 2 tips, but the third tip then is keep the inflammation level as low as you can going into surgery. I don't want to get the wrong idea with those first 2 tips that, oh, I'm just going to push because the surgery is going to fix everything. Doesn't quite work that way. If you go into surgery and your shoulder is really sore and inflamed and you've been working it too hard, either with the stretches and exercises or just with everyday use, it's still going to be really inflamed after surgery too. Now, obviously, depending on your surgery, the surgery itself is going to carry a certain amount of inflammation as well, which is to be expected. But really, if you can keep the inflammation as low as possible before surgery, that's going to be a good thing too. So you think of just avoiding things that really bother you, maybe using ice, things like that. So that's tip number 3. Actually, those were my 3 tips. Okay, and then I've got 3 more tips for after surgery that will help you speed up the recovery process too. So let's get into those. So after surgery then, tip number 1 that's very important for most of our patients is you need to know your precautions. Depending on your surgery, and precautions means things that you shouldn't do or that you shouldn't do until a certain time period. So you've heard of like maybe a post-surgical rehab protocol. Doctor says, from 0 to 2 weeks, you can only do this. From 2 weeks to 6 or 8 weeks, you can only do this. And your therapist is typically going to walk you through that. But as a patient, you really want to know that, especially what not to do. And this depends a lot on the type of surgery you've had. The best example I can give you was with a rotator cuff repair. So if you're having the rotator cuff repair, meaning they're actually taking the muscle that was torn and basically stitching it back together or re-anchoring it to the bone, which is the most common thing, you really don't want to mess up that surgery. So early on, your precautions are going to be like wear your sling for X amount of weeks, usually up to like 2 to 4 weeks. No active motion is a really common precaution after rotator cuff surgery, meaning that you don't want to take your arm out of the sling and actually like move it, because that could jeopardize the repair and it could lead to a tear of that repair, which is really bad news. So that's your first tip for after surgery. Really know your precautions, know what you're not supposed to do, especially, as well as what you're supposed to do. And if you don't know, talk to your therapist quickly, talk to your doctor, because you definitely want to be in the know and be proactive about it too. We get patients to say, oh, well, gosh, no one told me I shouldn't do that. It's like, well, geez, someone probably told you, but there's a lot going on with surgery, so make sure that you know going into it. So that's tip number 1. Tip number 2 is you want to start your range of motion early if you can. Again, bearing in mind your precautions, but again, don't be negligent and not know when you're supposed to do certain stretches and exercises. So if you can start motion early, because it's not a real involved rotator cuff tear or something like that, then you want to start your range of motion and your flexibility exercises as quickly as you can, because you want to avoid what we call frozen shoulder, which in the extreme version is a really tight, painful shoulder, usually requires some other intervention down the road. On the milder end of the scale, your shoulder is just going to be real tight and painful. So the earlier you can start, the better. So just know when you can and get that going. That's tip number 2. Tip number 3 then, a little bit self-serving you might say, but you want to start your physical therapy on time. So if the doctor says, hey, you can start your physical therapy at week 2, then make sure you call the PT clinic 2 weeks ahead or 4 weeks ahead, whatever you need to do, especially if they're busy, and get yourself on the books for 2 weeks after your surgery. If they say you can't start till week 4, great, get yourself on the books. Nothing worse than having a patient come in 6 weeks after surgery and get in for PT and they should have been in 2 weeks after surgery. So don't be one of those patients. Because again, that difference of 2 to 3 to 4 weeks when you should have been starting on exercises, the PT should have been stretching your shoulder for you. All those things, the longer you delay that, the harder it's going to be to get back your flexibility, the more likely you're going to have tightness and pain and potentially even frozen shoulder. So those are your 3 for after surgery. Know your precautions, start your range of motion early if you can, and start your PT on time. I hope that helps. And any other questions, leave a comment below or just shoot me an email. Thanks for watching.